50 years old now. And for the past 20 years, I've been performing laser eye surgery, and patients have been coming and talking to me with regards to difficulty reading up close. Friends of mine in restaurants always having trouble. I never quite understood it, never quite appreciated just how big an impediment it was to their life until it hit me. And suddenly, I was the one with the arms too short. I was the one not being able to have enough light. I was the one unable to read the menu. I was the one struggling to see what time it was on my watch. And suddenly, I realized the enormity of the problem. When we're talking about reading vision, I think eye surgeons go to the head of the class. We suddenly, and I wouldn't have one patient probably of mine ever disagree that they wouldn't want me to have the best near vision. So we're at a point now where we need that exquisite near vision. But in my mind, it was what just happened to me a week ago with my 15-year-old daughter, when I was responding to an email on my BlackBerry and she saw my font size and started to relentlessly torment me for the rest of the evening. And I just said, okay, I can't do this. I cannot wait to have the KAMRA reading vision procedure done myself. Well, after performing over 55,000 laser procedures over more than 2 decades, being always the person looking through the microscope as opposed to the person lying under the microscope, it's going to be a very unusual feeling. I'll be honest with you, I'm nervous. And I think that's normal, and I think that's healthy. And I always tell my patients, it's normal to be nervous. And for me, it's a sort of a nervous excitement. I'm completely comfortable with the procedure, completely comfortable with Dr. Tomita. The, KAMRA vision procedure, I think is, compared to all the other presbyopia options that I've looked at, it's the one I'm the most comfortable with by far. And I can't imagine, and I've had the opportunity to have virtually every procedure that's out there, that I would choose any other procedure over this. I am so excited about this for myself and for my patients. When I first learned about the KAMRA vision procedure, I got excited. I got very excited because it had 3 things that to me were really the critical factors. Number 1 by far was I could actually maintain my distance vision and gain my reading vision. Secondly, I could actually keep that reading vision for years. Unlike monovision or blended vision and some of the other procedures that have a limited degree of correction, over time you lose it. And then you're looking for another procedure, another solution. And third, and probably one of the most important, was safety. And that's the reversibility of this procedure. And what really tipped me over the edge was actually knowing other ophthalmologists who've had this done. And that's what convinced me to have it done myself. What greater endorsement could you have for a procedure than an eye surgeon, especially a refractive eye surgeon, having this procedure done? And when I thought about myself and what I was looking for, the KAMRA reading vision procedure was it. And, I decided I want to have it done. I don't want to be, stuck with reading glasses and walking around with these and looking for them and searching. I wanted to feel young, and I wanted to be able to enjoy my life. And I'm just so excited about this procedure. Thank you so much. I am beyond thrilled. First of all, yesterday was so much better than I expected.
Oh, okay.
I was very nervous. Despite how many surgeries I've done, being the patient, very difficult. You made me feel so comfortable. So thank you so much.
Oh, it's good for me too.
Yeah. Well, I'm sure it was a little bit, you know, it's always difficult doing a colleague, but you did a wonderful job. I felt completely comfortable and at ease. It was 100% painless, completely painless.
Thank you very
I had
much.
no pain, no difficulties at all. I just lied there, looked at the little green light, and 5 minutes later I was finished. And I just never been so happy and excited. Thank you.
It's very good.
Yes. And then I went to sleep. I was a good patient. I used my drops.
Yeah.
Went to sleep, slept through the whole night, didn't go out last night, didn't do anything.
Oh, it's good patience.
Just very good. Used
Yeah.
my drops through the night. And then when I woke up this morning, I was absolutely amazed. My vision was so good. I was reading the shampoo bottle, the fine print. When I had breakfast, I was reading the back of the sweetener. I could read the little tiny fine print. I grabbed the newspaper and I brought to show you. Okay. So here, this is just amazing. So, you know, severe plunge in exports to EU weighed on Japanese trade in July. Japanese exports slumped the most in 6 months in July.
Oh,
As sales stats, yes, and I can even pull it up here. The data suggested increased risk. I mean, it was just amazing. And then, you know, even if you do the really tiny stuff, you know, and I start looking at world markets, you know, Mexico, IPC, you know, I mean, it's incredible.
Incredible.
I wouldn't have been able to read any of this yesterday.
Yeah.
And less than 24 hours. I'm amazed.
Yeah.
Even though I hoped, I'm amazed.
Could you expect it?
You know,
Only wonders you can recover your visions like this.
You dream, you hope, but you don't expect.
Yeah.
It's so much better than I expected. And my distance vision is great. It may even be a little bit better, like you said, than it was before.
Yeah.
So I couldn't be happier. I mean, here's a procedure that, you know, yesterday I couldn't see, today I can see. It didn't hurt. It took less than 5 minutes. And I'm amazed.
Yeah.
And it reminds me of LASIK, you know, way back when all of a sudden people realized how amazing it was, and now we have the KAMRA reading vision procedure, and it's equally exciting.
Wow.
So, I mean, again, you're the world pioneer, most surgical experience in the world, highest standards in the world, the great Shinagawa Clinic. I feel privileged and honored to be here, and I thank you for your expertise.
Thank you very much too.
Thank you so much. So have a peek in my eye and
just look a little bit here. Look straight, please.
Pretty happy about that, huh?
extremely. Thank you again. I really appreciate it. The two things that were stressed to me, and I'm going to stress to my patients for their recovery after the surgery, are number one, to use their eye drops and to use them exactly as prescribed. The second thing is to make sure that I attend all my follow-up appointments, to make sure I see my doctor at the appropriate stages so that they can check my eye and make sure my recovery is good. Despite being a doctor, I plan to be the best patient. So one of the first things that I did today is, jumped all over the newspaper when they dropped it off. I could easily have read that in the past, but now even here, sort of bicycle lanes, maybe a little bit more than painted stripes on concrete, but in New York, they have become the stuff of lawsuits. Now, I can go ahead and shut my dominant right eye and use my KAMRA vision eye, and I can still read that in Mumbai it's 31 with a low of 26. But when I go ahead and shut my KAMRA eye and try and read with my other eye, it's just a big haze, and I just can't I can't see any of it. It just all disappears. It's just the haze. It's just really depressing. That's much better. I like that.